For my presentation, I want to focus on a expressive music therapy workshop that was done focusing on social growth. So this expressive music therapy workshop was done by Rosemary Fair and Diane Langen. It's written about in detail in their article, Expressive Music Therapy, Empowering Engaged Citizens and Communities. This workshop was done in 2000 at the Education and Social Change Conference in Sydney, Australia. There were 20 participants made up from different adults attending the conference. The goal for this workshop was exploring the potential that music therapy has in empowering people's voices individually and as a group to change and better society and their community. In the workshop, the participants were given the opportunity to learn about music therapy, what it is, some of the ideas and theories behind it, and also how it's normally practiced. They were also given the opportunity to share their own concerns as well as larger concerns facing their community and society as a whole. And they got to experience ways of expressing their concerns together and find solutions through creative expression, specifically in music. The workshop began by preparing participants for the creative expression. The instructor provided the participants with a short explanation of music therapy and some of the different ways that it's used. Then the participants were shown the instruments that were provided for them. These instruments were percussion instruments mostly, just a bunch of different kinds. And some of the participants volunteered and chose an instrument and participated in a short musical conversation. Afterwards, the group discussed how music can be used as a way of creatively having a conversation. Then the instructor had participants listen as she improvised a flute solo, asking them to pay attention to the images or feelings that the music that they were hearing brought to their mind. This was an example of receptive music therapy. After that, the participants discussed as a group their experiences. The group then discussed how music therapy or other expressive arts therapies could be used to empower social action. Before they began the creative expression part, everyone mapped out their boundaries, their comfort zones, where they were a little uncomfortable, and what they didn't want to do. The instructor made it clear that participants should practice self-care and not do something that is uncomfortable for them. So that was really focusing on the safety of the participant. The group then brainstormed, focusing on these questions. First, what issues concern me and my community? Secondly, what feelings do these concerns bring up? And then after that, what are things we can do about these feelings? So it was focused on not only identifying concerns, but also how can we problem solve and help better our communities. Then moving on to the creative expression portion of this workshop. Participants were asked to keep their concern in mind, what they had discussed during the brainstorming session, as they began the creative expression portion. To start off, participants were to find a rhythm inside of themselves and begin moving their body to that rhythm while they were standing up. Eventually, they would move on from that to making vocal sounds, to making words and phrases, but only as it fit into their comfort zones that they'd previously established. When participants were given time, participants were given time to write words by themselves that arose from the experience and related to the concerns and ideas that they brainstormed about earlier. So this is giving them time to really think through some of the ideas that their creative expression brought up. The group then gathered back together and, using the percussion instruments provided, created a group rhythm that supported individuals voicing the words and lyrics that they had come up with on their own, as they were comfortable with doing so. So obviously they weren't made to vocalize, but if they were comfortable to, they did. Once this came to an end, the group discussed their personal experiences and thoughts, and how they wanted to implement some of their ideas moving forward. So, reflecting on how this workshop went, the theoretical framework around the whole thing had its roots in the ecological expressive arts therapy and also community arts. This is shown by the goals being clearly focused on bettering the community and getting participants to feel empowered and be involved in change. The media used was music, specifically percussion, and also lyrics or words. Individuals could be functioning kinesthetically, affectively, cognitively, as well as creatively. Percussion instruments provide flexibility for different ages and populations, I believe. I would also say that they are easy to control as far as instruments go. They don't take a lot of musical skill. Most anyone could use them without feeling unable. It might be a problem with someone who has little sense of rhythm or beat, but for the most part, I think that percussion instruments could be effective with most populations. So, while the article by Fair and Langen only mentioned that this workshop was done the one time, I think it would be worth adapting and doing something similar specifically for children. Expressive music therapy has been shown to be effective when working with children, specifically in increasing social skills. So I think that something similar to what was done in this workshop could be really effective and fun to do with children. An example of this is shown in an article by Pater and Perrin called The Development of Social Behavior During Music Therapy, a Child Case Report. This article looks at an 8-year-old child with autism after participating in 20 weeks of music therapy, including making music along with the therapist. So, in this particular example, I think that similarly to the group workshop, the artist would have an instrument and also the child would. It was mentioned there was like a harmonica, which similarly to a percussion instrument is pretty easy to use. You don't have to learn too much about that. And also I think they use things like percussion instruments. So this child would make music along with the art therapist. So it was a kind of musical conversation or interaction similar to the workshop that we looked at earlier. So after participating in 20 weeks of the music therapy, this child showed a significant increase in his social skills. He retained those increases at least 6 months after the treatment had ended, which of course was the last time he was assessed, so we don't know how much longer or if it changed after that. So if the workshop was being adapted for children, I think that the goals could probably be shifted a little compared to the workshop that we looked at. Problem solving for a better community may be too complex for children. In the book, Expressive Therapies Continuum, a framework for using art in therapy by Lisa D. Hines, she writes that group workshops in the expressive therapies are best structured around the needs of the group. In the expressive music therapy workshop we looked at earlier, The goal of the group was predetermined to be focused on social change, but the individuals of the group presented what concerns they had for their community, which personalized the workshop to themselves. I think this could be adapted to a group of children in a similar way. If there was a kind of brainstorming session, like in the workshop example, the interests and needs of the group would be presented and the workshop could progress from there. I just think probably depending on the developmental stage of the children, what socioeconomic background they were from, this could help determine what their needs are and how the workshop could be structured. And here are the references for my presentation. Thank you for listening.